It's really hard to kind of think about having to continue with these restrictions. And it is a real balancing act that we're playing right now with our physical health and our mental health.
On Monday, the province announced new restrictions that will take effect as of December 28th and last at least until January 11th in the hopes to deter the spread of the new COVID-19 variant and help with the strain on the healthcare system. But what about the strain on the mental healthcare system? Restrictions coming will not cause a full lockdown, which is a saving grace for many small businesses and those who live alone, but the thought of more restrictions still pays a toll.
It is starting to wear on people. So that implication of, oh, here we go again, we are having to, reduce contact, has that negative implication about how will this affect my life and the decisions I have to make. And so it becomes a chronic stress situation where already people's resources are a little bit low, particularly thinking of also people in those businesses that have to reduce their capacity and what that means for them and their employees, and all of the implications is wearing on people for sure.
City News reached out to the Oakwood Cafe to see their reactions on these new restrictions, and owner Wendy May said this in part: "Honestly, emotionally, I'm exhausted, and the announcement today is nothing new. We have been under 50% since mid-December, and no capacity restrictions on retail at all is mind-boggling. Every single thing that is being restricted are places you already need to be fully vaccinated to attend in the first place, and yet places like malls, Walmart, and Costco have 100% capacity, and you can be fully unvaccinated to shop." Like May, many in the hospitality industry are mentally exhausted, and so Dr. Unger suggests that people pivot away from what they cannot control.
Dealing with things outside of our control is stressful, and so focusing on, okay, what are the things that are still within my control? What are the things that I can do to positively impact myself, my health, my mental health?
And while the province talks about the need to not overload the healthcare system, this has to be applied to mental health care as well, especially given the strains the pandemic has placed on people and their desire for treatment.
Similarly, we've had challenges with our mental health system prior to the pandemic that have not been addressed, and now the need has increased, and so those shortcomings are even more pronounced, and people are waiting even longer for those services.
Wait times for psychologist appointments are estimated to be up to a year as the need is ever growing and the pandemic reigns on. In Winnipeg, Brianne Foley, City News.